schedule another meeting the way that we've been doing, with the larger gathering and then breaking out into the subgroups with everybody that's here. I think our other option is finding some volunteers that maybe want to, like narrow down the subgroups, and then those smaller subgroups who volunteer to continue can kind of get together and do some wordsmithing and then, bring it back to the larger group, so that we don't have to meet, as one big collaborative. So just be thinking about those potential plans for moving forward. I know this is a really big ask, and it's a lot of coordination and a lot of folks involved. And so, a short amount of time. So does anybody have any questions or initial thoughts, suggestions? Okay, well, it's silent.
I do.
Yeah.
This is Fran.
Sure.
I'm not going to speak for everybody else, but this has been very tight, and the group has to, each subcommittee has to kind of get together and sort of come together and build consensus and then move on from that. And the time frame is really, really tight. So I would not be surprised if some of us think that it might be good for us to even have another meet up after this.
Yeah, absolutely. And that's, so we have until, and not that this is like any less tight, but we do have until, I believe it's the 15th before we have to present that final strategies, work group recommendations with the strategies and all that filled out. So we have a little bit of time to schedule something else if we want to do a big group meeting or even some individual smaller meetings. I see Denise O'Day raised her hand.
Hi, sorry. Yeah, the question I have is, in our group, and I think with the other groups as well, we're trying to determine like a percentage and amount of money, and that's really difficult to do without having data. And the only way to get that data is through the state, like through a data analyst. Does anybody know of a contact through the state? I just retired, or I probably could have found one. Social services, like just even if it was just the county, somebody at the county, because if we had one county, it's probably about the same for all the counties, I would think, or close, as far as like percentages on the waiting list, percentages of those that, don't qualify or do qualify but haven't received benefits, a timeline, that kind of thing, because it goes right hand in hand with the funding and the timeline that we're
looking at.
So
you're thinking about this for when we're developing those metrics as part of our Smarty.
Yes.
Oh, yeah.
Mm-hmm.
Yeah.
I tried to capture some of the data that I could get here in Baltimore County, and I was really only able to get hard numbers for senior care. Our database is separate from LTSS, for MDH's LTSS.
Mm-hmm.
So there's no way really to determine how many people are pending, how many, there's a lot, but I don't know how to access that information.
Right. So we're just going to be guessing then, which is not ideal at all. It's
no.
Right. There's someone at the Department of Health, Maryland Department of Health, that might be able to help us run some kind of report from their database.
Right.
So Liz, I see that Dan put his hand up, but Liz, did you have something related to this, or did you have something related to this, or response to this?
Yeah, I just wanted to kind of echo, what Denise is saying and agree completely. Whether we schedule another meeting, after this, or whether we even, I'd be willing to kind of, again, work offline with my partners on the smaller work group to, draft some language and things like that and make sure it looks good. But again, without that, again, exactly what Denise said, without that kind of baseline of, what the statistics are and what the percentages are, we really need that support to kind of make these solid, defensible recommendations, or otherwise they're just going to be, blank, reduce this by blank amount by blank date, without really kind of any kind of, leg to stand on for why we came up with those numbers.
Liz, did you have a
Yeah, I was going to suggest that, if there is a data source that is needed, that can be flagged for Tiffany and for our team to go back and see, is there a data source that we know exists at the state level that we have data for? And if not, that also builds into strategies, right? An assessment of something to get a baseline understanding is necessary to be able to develop that more detailed ask. So I would say if there are areas after this that you want to flag as groups to say we really need this data source, that's something that we can do some late work helping the groups to try to figure out if it exists so that you don't have to go and try to find a state contact. And the other item would be to flag it in a way where we get a sense of what the group wants to know and how it might be worked into the objective itself. So that if we cannot find resolution, that can be then built into a strategy. So I wanted to suggest that there's a lot of data sources that we're aware of. There's lots of things we have access to. There's lots of things that we don't all have access to for various reasons that have to do with data security. So that's my suggestion there.
Thanks. I think that's helpful. Does anybody else have any thoughts, comments, opinions about, how best to move forward right now, or should we get started in our breakout groups? I don't see any hands up or anybody off mute. So I hope that everybody did get those subgroup notes that were emailed to everyone this morning, so that you can refer back to those with some of the details as we work through these work group recommendation sheets. And if we could, when we're in our broken out into our subgroups, if you want to talk through, the objectives, the strategies, and then also maybe with your group, kind of get everybody's appetite, like see if people are interested in meeting again, or what it might look like if you, don't have all of that stuff finalized, because I suspect that we won't have all of that stuff finalized by the end of our work group meetings, but, just kind of see if there will be some folks that want to meet, in between, or how folks are thinking about that, so that when we come back together to do our report outs, that, we can make a decision on how best to move forward. So, okay, well, I guess who is it that usually breaks us into is it Jonathan?
Yeah, JJ, are you here to press the button?
Yep, I got it.
Awesome, thank you.
Awesome. All right, well, we'll see everybody back here in about 55-ish minutes, 50 minutes. this is the plan that will be used, that the state will use to, to meet these goals. And so it will be to the governor's office. It will also be on the, once the plan is finalized, it'll be on the MDOA's website or whatever, but this is like the roadmap of how we're going to achieve those 4 EPIC goals that the Department of Aging is proposing.
Thank you. That's helpful.
Mhm. Let's see. Okay, so Fran said by 2035, increase the number of
Mary.
affordable, accessible, and stable housing for older adults by
Break out groups
50% through
and
the
get
development
like
of new
30
housing,
20 or so
the
guys.
preservation of existing housing, and the expansion of community supports that contribute to housing stability for older adults. Everybody see that in the chat? Curious how people feel about that. I think it encompasses.
So it looks, so the way the sentence is structured, it looks like part A is accomplished by part B, but I don't know how community supports accomplishes part A.
Because I've added the word stability to part A. So part A includes affordable, accessible, and stable housing. And the stability is provided through the availability of community supports that help people keep their housing.
Does anybody else have any thoughts on?
Yeah, a couple things. I think there should be immediate action items that's in the objective, not just the strategies. If this is going to the governor's office, so go back to Scott's idea of putting, rather than starting with by 2035, we may end with by 2035. We may start with by increasing investment and partnership in these goals by X amount of dollars from the state. And then also, I do agree with Chelsea that we do need both increasing the stability and accessibility, but also it's really important to be aware of the growing number of involuntary displacements. I think it's I agree with Robert's point that we do need to have a positive statement, and Fran's framing that we do need to have a positive statement. We do need to actually frame the negative as well, because it is prevalent and growing, and expensive and ugly. So displacing seniors and the cost to the community is huge. And so the fact that we have a growing number of seniors in homeless shelters, doubling and tripling up, on waiting lists for senior housing, the involuntary displacements not to be glossed over, just in the direction of trying to frame it positive. We do need both, I think.
Fran?
I understand that, and I also agree that that's an important information to document. Does it make sense, Ruth, however, to use that as one of the measures of, as opposed to actually framing it in the statement? The statement is a public statement. Or you've actually suggested it might even be worded differently, which might make sense. But people are going to look at that and not necessarily understand some of that. So I come from the federal government, where a lot of what we did had to be written very, very carefully. So writing it in a way that suggests optimism and promise and going forward is more likely to be well received also by the public. And that's another reason why I thought having that information actually as a part of the objective didn't make sense at this point. but you could certainly use it as a way to measure the success of the objective.
And Scott, you have your hand up too? Oh, I can't hear you. You unmute still?
Sorry, trying again. I was kind of going back to the statement in the chat, the Fran's proposed metric. So the term stable housing, I guess, Fran, my question is, are you referring to like subsidized units that are below market rent? Is that what you're trying to capture? Just curious about that. And then perhaps, and I'm just thinking out loud here, perhaps a proxy for all of this, like, when I mean all of this, I mean capital, all caps, all of this, might be age restricted units. Allison, back me up here. They don't necessarily need to be subsidized to be age restricted. We do want, age restriction subsidized units like affordable housing for seniors, but that might be a different way to get at this altogether. Because one of the rejoinders you'll hear from Maryland DHCD and the Community Development Administration is that seniors can live in every affordable housing unit in the world. So, as stated, Fran, your objective here might just be to increase the supply of affordable housing because seniors could live everywhere. But something that Leading Age is advocating around is that having age-restricted units or communities of senior housing has sort of you can concentrate services, that you can concentrate community. There's a feeling of belonging, and there's more likely to have accommodations. So I mean that could be kind of the end goal, really, is we want more age-restricted units. We don't just want more affordable units across the whole portfolio. We want specifically age-restricted units. That might help get at it a little bit more.
And Scott, just to clarify, are you saying age-restricted affordable units or just age-restricted units in general? Like not knowing that even though LIHTC isn't subsidized, it's still affordable housing.
Well, that is a good question. And I would ask that for this group, I mean, if we create more senior living communities, not necessarily subsidized or, is that a goal in general, is just to create more senior living, or in particular, are we worried about the, affordability of the housing?
So I think because our epic goal that we're addressing is preparing Marylanders to afford, the 100-year lifespan or whatever, I think we have to, I think we have to kind of focus on that affordability piece as well. No doubt that, age restricted units in general would be helpful. I think because we're focused on the affordability aspect that we do have to, consider that. And then Allison dropped some great strategies in the chat, and she has her hand up. Allison, do you want to share?
Sure. Yeah, yes, I back you up, Scott, that I think more age-restricted units of affordable housing is important, but I think to Tiffany's point, the goal of this group has to be broader too. So I think that could be an important strategy in how we get to that. I think that it will be important that we're also looking at strategies to better understand and address challenges for affordable homeownership for older adults. And living in other settings that are not only age restricted, although we think that's a really important piece that we need to continue to develop, but not everybody's going to live there. And I think that just looking at affordability is difficult because affordable to who? Like something that's affordable to me is going to be very different than something that's affordable to someone else. So, and I think this is not the goal of this group, correct me if I'm wrong, Tiffany, is not just for individuals who are, at a really low income level, it's for everyone. So I think that the piece around developing more age-restricted, affordable senior housing units is a really important piece. But I think that some of the other things that we're talking about are broader in terms of affordability for folks who don't ever qualify for that type of housing too. Maybe I'm not making sense, but I did put some things I think better sometimes when I'm writing. So I did put some potential strategies we might think about in the chat.
Yeah, and I
Thanks,
kind of
Allison.
wanted
Scott, go
to, this is something we contend with a lot when we're talking about housing affordability challenges, is that there's kind of two schools of thought nationally, and they both apply in this context as well. So some folks feel that supply and demand, you need more, if you build more housing, then that'll drive down costs overall, right? So you need a supply side market-based strategy. The other camp argues that no matter how much housing you build, someone who makes 15% AMI is not going to be able to afford it. So you can't just have market-based approaches. You need subsidized units as well. So there's some people who think we just need to build, baby, build, and that's the solution to the affordability crisis. That's their mantra: build, baby, build. And then some people think that we need to create more subsidized units because it's really the extremely low income bands that are, just not able to stay afloat amidst any housing market, right? So in this context, I would say probably applies both, right? We need more age-restricted units across the board, and that's how you get rid of the 18-year wait times on senior living facilities. One could argue that these extremely high costs of senior living facilities is because of the short supply, right? So we need a market-based supply creation with just a lot more age-restricted units across the board. And we also need that other camp. We need more subsidized units, more affordable units, below market units for the very lower income bands. We kind of need both simultaneously. And I think that ties into kind of some of the options conversations we were having before about just seniors need more housing options. And again, we would need to use probably the vocabulary of age restricted, I think is kind of one of the main takeaways. And then I just kind of wanted to comment on the sort of, so I come from the homeless services space. And so, HUD measures chronic homelessness. That's how they think of it, is like those are worst case housing need scenarios, and they measure it in terms of like a deficit or a lack. So I understand, I think the comment, from before, I think, Robert, you were sort of one of the champions, but it sounds like there's a lot of other folks.
I have a whole rack. I mean, we like I said, we already have a bunch that they're in there that we kind of talked about last meeting. But I mean, we could throw them out there and just kind of start listing them all. I mean, Patricia, if you have, just throw them out there, and I'll throw mine out there, and anyone else throw them out there, and we'll just take a look at them and see how they.
Yeah. So probably, Liz, if you're going to take notes, would it be okay with you if you just open a blank page that we can list all of them, and then we'll cherry pick to get the 8?
Yeah, that's good.
I think that might be easier for me. I'm going to start getting weird if we get to 6 and I haven't gotten anything listed.
Sounds good. Do you want me to pass the ones you have already over here for investigation into our blank sheet?
Sure.
Okay.
Because I don't think some of these are strategies exactly, but I may not be understanding them enough to know. So, and I was not here when these were written. So Dan, it could be that you could just do a quick, what do they mean?
Sounds good. Hang on. Like I said, I'm sorry. There's like some work going on in my house. So I was down to the basement. Now I'm moving back up. So
I know, that's good.
Over my computer. It's just a lot going on. I'm running back and forth trying to watch the meeting at the same time. So
No worries. Take your time.
Woo! Jeez. Okay. Okay. So what's the question? I'm
All right,
running
so the question is, we had, there in these things that had letters,
Yeah.
ABC, there were probably 15, maybe.
I think
Um,
more. Got a lot here.
Yeah. So maybe you could yeah. Look at that. Look how close I was. It's my superpower. All right. Some of these
All right.
I understand. I'm not sure I understand all of them. So improving Medicare and advocating for Medicare parity.
All right.
I'm not sure. How is that a strategy? Explain that.
Well, let me tell. All right. That's a good one to start at. So, are you familiar with just parity in general, like parity, like insurance parity in general, Patricia?
I'm not sure I understand the use of that word in this setting.
Okay, so the federal government requires. I mean, there's laws. The Affordable Care Act expanded it, but before that, there was Congress passed. The Mental Health Parity and Addiction Equity.
Oh, sure. Yes.
Which is the law of the land. Which is the law of the land, which says that
right.
Commercially insured individuals and individuals that are on Medicaid, have federal protections that ensure that their insurance companies cannot discriminate against, behavioral health care, that have to provide behavioral health coverage for mental health and substance use care
Sure.
on par with medical and surgical
With Medicare,
care.
right.
So
with physical issues.
with physical issues, exactly.
Right.
And there's some problems with that, but that's the law of the land, and we keep working to make sure that it's implemented correctly. Medicare is not does not required to be parity compliant. So there's Medicare was left out of that law, and so folks that are using Medicare have really limited and discriminatory coverage of mental health and substance use care, where providers that are delivering Medicare services through Medicare, they don't have access to the same kinds of mental health coverage, and this is really problematic when folks over 65 are the fastest growing population with mental health and substance use needs, and just the coverage that they get through their insurance is really subpar. And so this is a federal issue, but what we've been but there's a lot of work going on at the federal level to try to make Medicare part of parity compliant.
Right.
And so the strategy here is just really encouraging our leaders of the state, whether it's the Governor Moore and the Department of Aging and the Department of Health, to really kind of join the fight at the federal level and kind of make Maryland a leader in pushing for behavioral health parity in Medicare at the federal level. And so that's kind of the strategy here. I mean, it just has such an impact. It's like the one thing that we see that has more impact than anything else on people's access to mental health and substance use care is just the lack of availability through Medicare. So
Hard agree.
Wonderful. Woo.
Easy. I mean, that hard agree on that. And every dollar that you spend on treatment or investment in somebody with substance abuse, if you think about how those things end up in the system, the impact on physical health and the impact on the risk of hospitalization or institutionalization, it's a good investment.
Right.
It will reduce. If you had parity, you would reduce institutionalization and hospitalizations.
100%. Yep.
It's a strategy we know works.
Yep. All right.
Yep. All right.
All right. So I'm gonna. Look, I think I'm gonna. Hang on a second here.
I'm wondering, should this then be improving Medicare by?
Oh, Liz, you have a really weird echo now. Oh, we all do. Maybe somebody.
Dan, I think
It's me.
I think that happens when we join in two places. Hey,
Yep.
All right.
All right.
Can
Thank
People
you.
hear me now and see me now.
You're great.
I've made it back
You're
to my office, and
Yeah.
I'm on the computer instead of the phone. So perfect. Sorry for all the craziness.
We have other folks on the call with us too. I don't have names. I have my list says 2 others.
So Stephanie and Jonathan.
Okay.
Whoops. Okay. Yeah. I'm Stephanie O'Day. Sorry, I'm off camera because I'm trying to shove down a tiny bit of food for the first time.
You're fine. You're
But I'm
fine.
listening. I'm going to chime in when I'm fueled up
Okay.
again.
Okay. All right. So let's go to number 2, Dan.
real quick before you move on, should this one be improving Medicare by advocating for Medicare parity, or are there other things in mind here? And if so, should those be spelled out a little bit?
Oh, well, the other ones, I remember that we had folks on our first call who really were interested in Medicare also having a dental option.
Yeah.
And
Maybe it should be something.
option.
Maybe it should be like something like address limitations in Medicare cover, health coverage available through Medicare by advocating for behavioral health parity and dental coverage and other by advocating to address by advocating at the federal level to address limitations in coverage, including behavioral health and dental.
Yeah, and vision.
Yes, and vision. I would put behavioral health parity instead of just Medicare parity, just goes.
Yeah, because it's be more clear to people like me.
Yeah. Well,
Used to the word.
it's very wonky, yes, but it's like so super important. So.
I know it's a buzzword and it means a lot to you. So that's I now that I understand it and remember that I'd heard that word before, it makes perfect sense.
All right.
Yeah. Okay. I think that's really good.
Awesome.
Okay. Medicare savings plans, increasing awareness of and utilization of. Is that like an HSA? Like, what is a Medicare savings plan? I don't even know what it
I'm
is.
not familiar with that. That wasn't my recommendation. I'm not familiar with that. I don't know what that is.
So Medicare savings plans provide additional funding for people to be able to afford their Medicare premiums. There's certain eligibility criteria for them. And I believe in many places, including Maryland, many more people are eligible to access.
No, that's one of the strategies, right? Teaching people how important that is. I mean, you can't, people don't do it unless they know it's important. Right, Mike?
So
Yeah, so with our objective or strategy is education on during lifespan, different phases that you go through, and how do you educate the people of Maryland to make smart decisions financially and not be stupid.
okay, and are there any like metrics associated with that? So like for instance, in the formerly written objective, it says, increase this by X% over. So
David had put in the chat, he put his kept the 25% would be a metric, I guess.
okay.
So,
I think that's just what we had prior. I just arranged what we had before.
so if you want people to increase their retirement, right? How do you get people to increase their retirement fund or to sign up with the employer or whatever?
So that's what I'm saying is that it's a little bit confusing because the objectives are kind of getting blended in with the strategies here. So if the strategy is like the how are we going to do this, then the objective would be
people. The strategy is how are we going to educate people? That's what I see.
Right. So the objectives are increasing participation in retirement by X amount over. Does that make sense? I mean, it seems like there's been a lot of focus on the objective being creating this continuum of financial literacy, but that's really the strategy. So I'm just trying to get back to when we report out, what are we telling them what the objective is going to be? Is it going to be to increase participation in retirement savings programs by 25% over the next 15 years and increase the average salary of workers? Is it just one or the other? Like that, I think that's a good starting place so that once the report out comes, that.
I don't know. I'm confused because I think in actuality, if you think about it, what you're trying to do is make Marylanders more educated and to be able to save to live long. Remember, we're talking about longevity. So they have to know to do what we want them to do. So you're really trying to educate Marylanders into what they're supposed to do and to get them to do it. Does that make any sense?
Yeah, but I see what DR is getting at is that what's the outcome? So the outcome is, the improving the financial security by a percentage over a number of years,
right?
And to, increase people's average income. And the way you're going to get there is, number one, by improving the continuum, the financial literacy across the continuum.
Right,
that's the number one strategy. So I hear what you're saying, Deara. I think that's maybe we repurpose our words and come up with what is the outcome. The outcome is having people have their financial security improved. That's the outcome.
Right.
Make more money. That's the outcome. And those strategies are going to be the four things, plus maybe number one would be the thing we've been harping on is create a continuum of financial literacy education to last through the lifespan.
Right.
And then the strategy could be different, sub-strategies different at each age category.
Okay.
So I
Is
also,
that
I
what
just
you were
guess-
getting at?
Yeah,
Kiara?
and I guess I'm also trying to understand, is the group in consensus about both of those outcomes being what you'd like to report out on? The having improved financial security, and that's really like
that's the main thing, yeah.
That's the right. So to make it more specific, the language currently says increasing retirement participation in retirement savings programs by X amount over the next X amount of years. So that's like part one. And then the second part was increasing the average salary. Are you looking to report out on both of those outcomes, or is the group in consensus towards leaning towards one more than the other?
I don't think you can just have one thing, like increase people's retirement savings. Not because there's still only going to be a small percentage who are going to do it. You want to increase the percentage, yes, but that's not going to give them financial literacy or financial security.
So broad level improved financial security, and then kind of some of the meat is going to be retirement, education. I mean, education is a strategy.
Working longer, working longer. Making all those things, what you just said. So it's financial security, right? Education, which will provide financial security. And here's the strategy with the things you just said. By increasing the retirement fund, by working longer, by spending wisely. In other words, if you don't waste a lot of money on credit card interest, because you didn't pay your credit card off, things like that increases your salary. Or buying a house and not paying rent to a landlord increases your security. So somebody else speak.
Do we still have a metric in the objective at this point?
Right now, it's improved financial security is the broad umbrella branch. And then we do still have a metric for the retirement saving program participation. Right. But for instance, like working longer, you could get more specific about that one. Spending wisely, you can get more specific too.
And all those are strategies, like the overall objective is improve financial security. Is that where we are?
I think
seems like everybody agree with that.
Increasing financial education and security, and therefore security.
Are we okay not to have a metric in the objective, or do we have to have a metric in there?
It makes it a little bit more tangible, like that. I'm coming back to the SMART goals. So making it a little bit more specific than that. So that's why I kept bringing to the forefront, like the participation in retirement savings by 25% over the next 15 years, because that's like a really good.
Yeah, it is a really good
specific one.
Well, now educating the high school students is 100%.
But that's
if it's required, you're 100%,
okay.
Right, you're 100% covered if it's required, mandated by the state.
But that's a strategy. So if we have it sounds like we can build 8 strategies.
Yes.
And I think if we knock down this long sentence to continue it as it reads, improve financial security by increasing participation in retirement savings programs by 25% over the next 15 years, and increasing the average salary of workers by increasing the average salary of older workers by 10% over the next 15 years. Is that, I'm making that up, but then just put a period there, and then the rest go into objective.
That's good. Now, not only increasing their salary, but increasing their workforce, right?
Are you saying?
Well, that would be a strategy.
Yes.
And do we want to say increase the salary of all workers across all age groups, or do we just want to focus on older people? If we're
I think only older people, because it's inflationary if we say, oh, just increase everybody's salary.
so we're trying to get them to increase their retirement savings at any age, but increase the average salary of older workers.
Yes, yes. Mhm. And get them to work longer. If able. Again, because we're thinking longevity here. Okay, so we need about 5 more strategies to get 8, right?
So under increasing the average salary of older workers by 10% over the next 15 years, a strategy identified is increasing participation in the workforce or workforce
Yes.
participation.
Oh yeah, that's a good one. There you go.
And then do we have any other ideas for that particular part of the objective?
Well, it would be creating our number 3 objective. So it's creating employer-specific education
Yes.
opportunities on ageism and aging workers as a protected class.
Yes, as a protected class.
I think that
Very
supports that
good. Mhm.
part of the strategy, the objective.
They become a protected class. They
Okay.
also need the employer also needs to be protected. Like I said before, you can't, if you hire an older worker now, it costs you a fortune to let them go because they're a protected class in that range. But there must be some way that there's a program that you sign something that says, you know what I'm talking about? Maybe you're hired under this special work program, right? And that if you don't work out, you can be released without penalties. That's the biggest thing from getting the employers to hire older people. If something doesn't work out, they have to pay thousands of dollars to an attorney to get them to leave. So that would come under a strategy of encouraging the employers, protecting the employers when hiring older citizens.
Does it sound good to put maybe incentivizing employers?
Yes, yeah. Or it's also protecting. Yeah, I mean, I personally had a case.
Those would be two. I think those would be 2 separate strategies.
Mm-hmm.
Because if you're incentivizing employers, you're creating a program.
Yes.
Of which there are probably other programs similar to incentivizing employers to bring in other protected classes. And then there, by employer education, you're eliminating the ageism and allowing more workers to stay in the workforce. So that's where you cover that aspect of protecting the employees.
So
Now,
that brings the total number of strategies for both to 4 for a total of 8. But feel free to continue. I just want you all to know there's about 16 minutes left, so the conversation is good. But just wanted to say with the notes that I've taken.
We have 8 strategies already.
So I'll share my screen to show you kind of what I have here. But once I'm kind of still like getting my notes together. Okay. So I took some of the existing strategies to put them under here. So I'll give you all a moment to just take a look at what I have written here and let me know if there's anything that I might be missing or if a strategy might not belong under.
But okay. So where's our objective? I mean, I don't see it on, is it on a different piece of paper?
No. So the primary umbrella objective is improve financial security, and the sentence is going to just be these are the two different parts of the objective.
Yes. But the
so-
strategy, I mean, okay, so we turned this strategy into an objective, right? Creating a continuum of financial literacy education.
Yeah, so that's kind of where this one comes in. So I'll just put continuum of
Starting in high school.
So it would basically be improving financial security by increasing the average salary of older workers by 10% over the next 15 years and raising retirement saving program participation by 25% over the next 15 years. And then these are the two major strategies that fall under both of those. Sorry, it might have been easier if I typed it out as a sentence, but I kind of was just going as you all were talking.
So tell me again, if anyone can answer this, what is our definition of older workers in the first one?
I would think older, over 80, 65, right? Because isn't that when most people are they can take Social Security and leave?
What would the Maryland Department of Aging say?
That's a good question.
Mm-hmm.
And because Mary Lou, did you say 40 and over is the protected class?
Yes, which is kind of antiquated now because 40 is so young.
Well, I partly wonder if we pick an age and then it doesn't encompass a larger age range, if it opens up other legalities as far as if one group gets something that the other group doesn't get.
I see what you're saying. The legislators can figure that one out, right? They should redo the 40 protected 40-year-old.
Well, if you do, you could do 50 plus, and you could just say increasing the average salary of 50 plus work, 50 age 50 and older workers, and you could get rid of protected class, say creating employer-specific educational opportunities on ageism and aging workers over 50 years old, or over 50, aging workers over 50.
I think Maryland
And change incentivizing employers to bring in workers over age 50. So everywhere that it's ambiguous, put in that you're, the 50 plus work group.
that can be
Oh, go
changed.
ahead.
No. I guess that could be changed. But I think when you say incentivizing and protecting employers, it's very important to say protect.
I don't know if we have it in here, and it wasn't my idea, but somebody had said in one of our other meetings about taking away the rule where when you reach Social Security age, having to work under a certain amount of hours.
Right. Or make a certain amount of money.
Yeah, money, right? Money.
So creating
I don't know.
almost similar to like universal salary or universal earning requirements for
Well, the
Even
best thing,
Social Security age people.
you just hit on a good one.
But then that adds
Maryland
another.
should not tax retirement income. There are many states that don't tax retirement income. You could throw.
Your MAPS staff are offering application assistance and can help navigate getting the application completed, mailed off, and submitted. What you're saying is once it's submitted, determining eligibility or tracking that application or being able to follow up, is that the problem? Or
I mean, yeah, when you look at, I mean, again, it goes back to waiver for so much of it, but when you look at those plans of services hanging for so long, and or the big debacle we had with people getting disenrolled from CFC and then not getting anything, just being dropped and not understanding what happened, and then not getting the invitation to CO. So we were spending lots and lots of hours, trying to bridge the gap between MDH and the consumer.
Yeah, so it sounds like what we're really asking for here is not necessarily navigational specialists in every arena, but we're really looking for it in OLTSS, EDD, the departments within the Maryland Department of Health that govern waiver and all of the different processes. So there's probably, and I don't know what division it would be, but somebody to reach out to if your client you did a screening for, made a referral for, isn't getting their ARIS evaluation or isn't being assigned a sports planner, or application seems to be stalled, or plan of service, although that's the supports planner's role, plan of service is stalled and it's not being reviewed or approved in a timely manner, and more transparency around timelines and what to expect once applications are being submitted.
I'm just writing something down. Hold on, guys.
You got to write it while it's in there. It's gone.
You better believe that.
I have a quick question because I see that our time is winding down. What are we supposed to come away with today, and are we on track with that?
Yeah, I think we are. So what we really want to come away with is our arching objective, and I think it's exactly what you wrote, Claire, is perfect. And then we want to come away with up to 8 strategies. You don't have to go up to 8, but I think we have a strategy of around income eligibility. I think we have a strategy around navigational specialists. I think we have a strategy on a universal application system, streamlining, and you wrote it much nicer than I, streamlining the application process. I think that we also need to add increasing awareness. I think it's an underlying thing that we do already, but we can't ever let that go. So awareness is everything. So I think the 5th would be universal screen process. So I think we've kind of identified at least 5. And if y'all heard anything that, if I left anything out that we should or whatever, but I think we've kind of come up with our 1 objective and 5 strategies. Wordsmithing still needs to come with it, and then answering a lot of these questions. But I think we did a nice job.
Would increased funding be a strategy, or that's just because the fund, we need more resources and more funding for all these programs?
Yeah.
Yeah.
Is it a strategy? Let me just write it down so it's in our thing. I think it's hopefully an outcome.
Yeah.
Should we add something about being mindful of technology? And by that, I mean, sometimes we can rely too heavily on online for people who, there's still a contingent of people who need to call on a telephone and speak to a human person, not to, press 1 for this, press 2 for that. So I don't know where that fits, but a lot of times with, these services for older adults or adults with disabilities, there can be too heavy of a reliance on the internet.
And they just won't do it. They won't apply.
Well, or they get in and they drop off because after the 3rd push this or that, it's too confusing.
Right. I think that's one of the things we often hear is that, oh, you answer the phone, because a lot of people are either on hold for very, 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 very long, or again, they're going through that process. So I think there is some kind of marriage that needs to happen between that hand-holding personal level, but also the ease of getting the application done and submitted.
Well, wouldn't that go within streamlining the application process?
Yeah, totally.
Yeah.
I know we're getting ready to get off, but just something for us or for you all to think about. Yeah, you know, you hear the term, it takes the village. Sometimes it's not just about the government aspect, but there are something called the villages, or the village is a group of neighboring neighbors who are helping out with seniors, whether it's taking them to doctor's appointments or calling to check in on them, or having a social worker that comes out to them. And these are neighboring neighbors who are getting together to form these little groups throughout Maryland. And just something to think about. I don't think that many of Marylanders are aware of them. And just connecting with people that can help, that lives right next door to you, sometimes works better than kind of accessing things that we know is on a wait list that can take a long time.
Actually, villages are getting a lot of, you're 100% right. They're really starting to come. I think they're probably talking about that in another part of Longevity Ready Maryland. And Montgomery County did get funding to do a village study. And I think those are part of those things that they're doing. We're not going to have enough places for people to go if they can't stay in their homes. So we've got to create these other resources, not just through senior care, but exactly kind of your own call check or share ride, or, you know, socialization. Someone that just calls you every Tuesday and Friday and talks to you for 30 minutes. You know, so yes, it's huge. And I think it's going to get bigger and bigger. And we're going to have to keep a point of who all these are, so that we can get in to help them to know it. So yeah, I see that becoming bigger and bigger. Specialists, streamline process, threshold. All right, we have 3 minutes left. Any parting words?
Should we establish another time outside of the scheduled meeting?
I'm so glad you said that. Thank you, Denise. So I am willing, if you guys would like, to kind of put this stuff together. This is our last big meeting, but if you would like, as a work group, to have another meeting between now and probably no longer than maybe next week, because then those of us here at MDOA have to kind of get to writing these. I am okay to have another work group, you know, no more than an hour, that we might could continue to wordsmith this and maybe go through more of these questions of who are the key partners, so that we can get it all in there. Is that too much? Anybody okay with that? Would you like to do one more meeting to just kind of keep hashing these down?
I'm okay with it.
Okay. Everybody okay? All right. Then I will look at my calendar, and Mark's, and Amanda, if you would join us too. And we'll see if we can't get something on. Maybe I'll send out something to the group just 2 times between now and maybe next Wednesday. I will then also, in the next 24 hours, try to get a lot of this written up so you guys can see it. And then I'm going to send those questions, because that's kind of where we then got to start. Okay, if we really want to do a universal screening process, who all do we have to get involved? And we've got that, but does anybody have a strategy? So we'll kind of, I'll try to get a nice email to us. And so we'll try to meet one more time, just as this little group. So I appreciate all y'all's help. I think we did a lot. So
thank you.
Yeah. Oh, well, it's been fun. Y'all are teaching me. As Amanda knows, this is not my thing. So very good. All right. I think we can go back.
Are we all back? I don't know how to tell if we're all back. I think the breakout rooms ended and kicked everybody out. So I'm pretty sure we're all here. So I hope your conversations were productive. We have about 20 minutes left. We go to 2:30. Yeah. So we have about 20 minutes left, and I'm hoping that each of the work groups could maybe take 4 to 5 minutes and, tell us what kind of progress you made, whether you've, gotten to the point where you've finalized anything, or maybe summarize some of those comments. So I can start with housing since I'm already unmuted. So we made some progress in the objective, kind of framing it instead of around, there were so many things that we wanted to capture. There was the affordability, the accessibility, livability, and all of that. So while we still are going to meet again and, do some wordsmithing, we're more focused on so the percentage of seniors not facing worst case scenario housing needs, as defined as spending more than 50% of income on housing, living beyond the threshold for severe overcrowding, and having accessibility challenges that make the living situation unsustainable. So it's really, focusing on meeting those housing needs as opposed to some of the other metrics that we had tossed around in the last conversations. We did get into some of the strategies, just very generally, thinking that the strategies may help inform, inform our objective and the metrics that we are going to focus on. And so thinking about home repair and adaptation, housing options navigation, and housing counseling to keep people in their home, different options of preservation and development with a focus on zoning policy and addressing NIMBYism, and then housing subsidies, eviction prevention, housing policy advocacy, estate planning around like tangled title, and then reducing the racial disparities in the number of involuntary housing displacements. And we realize we have to hone in a little bit and get a little bit more specific around some of these strategies and what that might look like. But I think our group is going to reconvene again and kind of divide those strategies up in, certain portions of each of the subgroup will take, 1 or 2 strategies and kind of work on those in a small group to wordsmith. So that's where we are. Can I toss it over to the next subgroup?
I can go, Tiffany, if you want. So we are the affording healthcare, making healthcare more affordable subgroup, and we came up with a recommended objective that we think fits all the SMARTY goals, every single one of those SMARTY acronym letters, and we came up with 8 suggested strategies for achieving it. So we knocked it out of the park, I think. So I'm
so impressed, by the way. I'm just like, wow, let's hear it.
All right. So the recommended objective is to decrease, understanding that, so it's decrease unnecessary hospitalizations and institutionalizations by a certain percentage over the next certain number of years that we haven't identified those specifics yet, and reinvest those savings into these following strategies. And so, this is a recognition that just unnecessary hospitalizations, really, and institutionalizations drive healthcare costs, totally, and for the individual and for the state. And so that's why we think, again, that's a good objective. It's what are the things? It's specific, measurable, achievable, realistic, equitable, et cetera. And so the strategies we came up with for advancing this objective are: address limitations in health coverage provided by Medicare by advocating at the federal level for behavioral health parity, dental, and vision coverage, increasing awareness of and utilization of programs and resources to save for healthcare costs and increase self-determination, including Medicare savings plans, health savings accounts, mental health advance directives, end-of-life care, and others. Build a comprehensive network of equitable and accessible home and community-based mental health and substance use services. Expand the use of technology, including telehealth and other home-based services. Improve physical accessibility of behavioral health and other health services. develop a statewide community-based behavioral health long-term care option to meet the needs of people who are aging with severe mental illness. And this is, I mean, there's a lot of behavioral health stuff here too, but again, there's report after report that shows that unaddressed behavioral health issues are one of the things that drives hospitalization and things like that too. So, and then the modernize and automate the federally mandated pre-admission screening and resident review process to reduce length of stay and prevent unnecessary institutionalization. And then number 8 is increased utilization of social determinants of health and behavioral health screening, referral, and services in primary care settings. So that's our list. And so we didn't figure out the short-term, medium-term, or long-term yet, but we think it's a pretty solid list to address the overall objective. And Patricia or anybody else.
That's really very, very impressive. And just to touch on your unaddressed mental health needs, that was something that actually came up in the housing work group too, because that's something that contributes to chronic homelessness. And so I'm glad to hear that was mentioned. Next work group.
I'll go. So we had LTSS, and we came up with our objective, thanks to several very smart wordsmiths within the group, to create and implement an improved comprehensive eligibility process to expand access to LTSS, which is what we want to do. And we came up with 6 strategies. Don't know if we're going to need 8, but we got a wordsmith to, just like you said, Tiffany, but, kind of taking a navigational specialist approach to help people get through the process, streamlining the application process. We do have MD Think, and so there's some other things already going on. We need to do some research and probably some proposals on the income eligibility thresholds, which might include some asset test, maybe eliminating asset means testing and things like that. Talking about maybe a more universal application process, which is a little different than streamlining the process, because one's about actually getting through the system and others is what the system we even created. We did talk about increasing awareness. It's such a huge program, and it's always about, people don't know what it is, so we're never going to do that. And then we actually talked about universal screening. So those are the 6. Like you and your group, Tiffany, we're going to meet one more time, hopefully between now and next Wednesday. We're going to take the document from LRM, which then for each strategy has to have kind of information that comes, what other groups would we need to work with, what other initiatives are going on about that. Is this going to be a legislative pull or request and things like that? So we're going to kind of do some homework over the next couple of days and hope to meet, by next Wednesday, and then we'll start, we should be done with the meeting, but then everything will be more wordsmith with more directives of answering those questions. So group did awesome. They did a really good job. So that's where we're at.
Great. Thank you so much. Okay. I'll turn it over to the last work group, the financial stability.
The last? All righty. Our major objective is to improve financial security. And we broke it down into 2 major strategies and 3 and 5 strategies underneath that. So the first strategy is increasing the average salary of age 50 and older workers by 10% over the next 15 years. Under that, we are creating employer-specific educational opportunities on ageism and the benefits of workers over 50. Incentivizing and protecting employers that bring in workers over age 50. Prioritizing employer education to decrease ageism. Creating legislation to support the aging workforce 50 and older through tax incentives or reductions. And the next major one was raising retirement savings program participation by 25% over the next 15 years. And this can be accomplished through a continuum of financial literacy education throughout the lifespan, promoting education for the various age groups, starting with a mandatory financial literacy education in high school. spreading awareness about existing programs like the Maryland Saves program, and incorporating quick access on various governmental platforms. Employ CPAs that provide pro bono services for education across the continuum, and incentivize CPAs to grow their client base. So that's where we are with that.
Great. Wow, I really do feel like everybody made a lot of progress this time. Any other thoughts or comments before we kind of start wrapping up with next steps? Awesome. So then it sounds like each of the subgroups is going to schedule another meeting to wordsmith some things and finalize some things. And then maybe when Izzy returns, I'll get with her and then we'll find a time to reconvene the larger group. And then maybe we can sort of report out on those subgroup meetings that we had, if that works for everybody. And then when you're in your subgroup meetings, using really using the work group recommendation and completing it, filling it out, following those examples. So that way, when we reconvene, we'll have a lot of that stuff kind of worked out and formatted in the way that the state is asking that we do. Liz, are you still with us, Liz? Do you have anything to add, or maybe thoughts about what some of the other groups are doing to get closer to finalizing the objectives?
Yeah, a lot of the other work groups have been meeting outside of these core meetings. I think you guys have made amazing progress for the limited time that you've been working together. So congratulations. So I think that's absolutely something that this group can utilize. And it sounds like you're planning to. I think that makes sense. And I think the other thing that a lot of groups are doing is working collaboratively offline by doing a shared document. So for example, our group has a shared document within our working folder. We created sort of a boarding healthcare subgroup folder, and we've got a document there. I'm going to upload the notes from the group's discussion today, where they can then really do that wordsmithing, right? So it might actually take us all sitting at a desk and really thinking through and doing some research. So I think those are options that are available to the group. And if folks are still at this point having trouble accessing those folders, do let us know what email address you need on there, and we'll make sure that you can get in there.
And could anybody that took notes or, like kind of wordsmith the objectives and wrote all the stuff down and reported out, if you guys could send me the notes from the from those subgroup meetings. I know this larger room or whatever is what we're saying here is transcribed, but those subgroup meetings are not. And so those notes are really valuable. If you could send me those, I think that would be really helpful. And I think we can make sure that we get them up in those shared folders so that everybody can access them.
And Tiffany, I would just recommend too that after sort of the next round of folks meeting, when you feel like I have this draft, just to then notify the staffing, and we could put them in one document that then this group can review as a whole.
That would be great. All right. Anything else to add or to? And the final deadline, November 15th, right? To have these work group recommendations all formatted and ready to go, right, Liz?
That is our final deadline, but we also have our stakeholder advisory group, of which you've got members in here that are on that, and the fourth meeting of that, where the group will be reviewing and trying to kind of make some final decisions. That's on the 12th. So we can shoot for within the next 1 to 2 weeks of really getting your solid draft versions. You might have a tweak in the language here and there, but the content will pretty much be there. I think that'll be extremely helpful to move the process forward, so that the members of this group who are part of the stakeholder advisory group can then get their eyes on it. And because what we're finding is, in some of these groups, right, some of these subgroups, we might be having some similar conversations and thinking of some same things that can then come together. so that we're avoiding duplication and making this, you know, a really strong and concise plan. We think that that's going to happen right across the work groups, where a lot of what we're talking about in the healthcare relates to the larger health work group, of course. So there might be some consolidating there too, that the larger, that needs to be looked at across all work groups. So definitely don't wait, you know, try to move them forward as fast as, not as fast as you can, but feel free within the next couple of weeks to try to get something in writing that you feel is really solid, so that we can kind of push them up for that final review. And these are recommendations. So if there's some additional information you don't have, some context that you think, oh, I just don't know, or this needs to be looked into, that can always be part of what you submit as part of your recommendation. That is not a bad thing to say, we need to learn more. And then if we can't figure out whether that information is available, that becomes a great strategy for us to begin to pursue, to think about how to operationalize this plan.
Great. Yeah, I think that all makes sense. And then maybe we shoot for having all of our stuff together. If the stakeholder advisory group meets Tuesday the 12th, maybe our goal is to have everything in by close of business on Friday, November 8th. That way, you know, that gives us some time. And then it would also give the stakeholder advisory group, you know, a day or so to look over those items and kind of familiarize themselves with it, so that they can come to the table and have some meaningful discussion around them on the afternoon of the 12th. So. Great. Well, hopefully every work group has somebody who's going to kind of serve as the point person to gather everyone together. And then I will get with Izzy when she returns, and we'll figure out if we're going to reconvene the whole group again, and when that'll be. And then we'll have that goal of close of business Friday, November 8th, to have everything all tied up and ready to go.
That sounds great, Tiffany. I would just check really quick. Is there anyone who feels that you don't know if you're meeting again, or you don't have a point person, or you're not sure? If so, you can either raise your hand, or you can just message Tiffany and myself. I'll put my email in here afterwards. We just want to make sure that this is actionable for you. So we can help to do that coordination if you don't have somebody who's already doing that coordination. We'll just follow up with the group and get something scheduled. I'm putting my information in the chat right there. So feel free to reach out on that. And then I do want to just recognize Tiffany for doing an amazing job acting as the chair of this work group. She has put so much work into it. She's so clearly an expert in what she does, and we just so appreciate having you part of this process, Tiffany.
Great. Thank you so much. And Carl raised his hand. I see that. Carl, did you mean to raise your hand? Do you have a comment, question?
Carl, you're on mute.
Oh, you're on mute, Carl.
So bottom left, Carl, you'll want to make sure that it's gray and not red, the microphone button. We're still seeing you on mute.
I just wanted to say, Tiffany, you're doing a wonderful job.
Unmute myself too. Thank you so much. Thank you, everybody. No, this has really been an honor to, you know, be the co-chair or co-chair with Izzy on this. And, you know, it's just been really great. And I'm looking forward to seeing all of this kind of come to fruition. So thank you. And kudos to everybody. I think you guys have done an amazing job as well. So. All right, folks. Well, I think that's that. Thank you. See ya.